how does someone know like if they need to go some to your place to get their face fixed, basically? You know what I mean? Like, is it just a personal feeling like, oh, I don't like how my face looks, or is there seriously like something wrong?
Usually it's just the I don't like something,
Yeah.
which it's kind of staggering to me. A lot of women will come in, I'll do a consultation, and they come to me and say, oh, I've just got this one little brown spot, or everyone thinks they have to go to a dermatologist or a doctor for something. And if there's anything suspicious, yes, absolutely go see a dermatologist. That's where they're going to find out if it's something that needs to be biopsied. But when it comes to cosmetically, I point things out all the time. I never used to because I thought it was somewhat offensive, but I just ask permission. Hey, can I be blunt with you and tell you what I see? And they may come in for one little, brown spot, but I put them through this VISIA skin analysis machine. It'll scan their face. We'll put them in the computer. We'll be able to zoom in on everything, look underneath the skin, really get a full spectrum of all of it. And it tells me the age of your skin also. So you might be 40, but your skin might be 50. And so our goal is then to take that, find out why it's 50 years old and fix that problem. And so a lot of women come in for that, again, that one brown spot. And I can point out and say, well, what about this or this or this? And I hear most of the time, oh, I didn't know I could do anything about that. I didn't know I could fix that. I didn't know that could go away. I just thought I had to live with it for the rest of my life, because they do go to derms, and not all of them, and they don't want to do anything cosmetic. And so they just say, oh, that's something you have to live with. And so when they come to me, they're just surprised to say, oh, you can do that. I actually had a client earlier today with the same exact thing. I did her permanent eyebrows. And then as we were doing the eyebrows, I was kind of talking about some other thing. Hey, does that bother you? And she said, yeah, but whatever, I can't do anything about it. And I said, well, yeah, I can do it right now, actually, if you want me to. And so she was so excited. And so I got rid of a bunch of, cherangiomas, these little red dots. We got rid of some sun damage, a couple of small keratomas, little moles.
Mm-hmm.
And so she left, looked like she got stung by bees, but in a couple of days, she won't have any of those imperfections on her face anymore. And she had no idea that she could ever even get rid of those.
Wait, you can get rid of moles?
Yeah.
So like this thing I got in my head, like
That's that over there.
Yeah, you can get rid of that?
Yeah. Yeah, as long as it's something that's been checked by a dermatologist.
Yeah.
Moles have to be checked to make sure.
Yeah, I go every year and they're like, oh no, it's fine.
It's all good. Yeah, if it's benign, something like that, then yeah, cosmetically I can get rid of it. And if you get it done, and again, I'm not saying anything bad about derms, but if you get it done there, they're not caring so much what it looks like after.
Yeah.
They just want to get rid of the thing.
Yeah.
And that's just what they do. So they want to cut. It's what it is. So what I'm going to do is do it in stages if I think I need to, all at once if I have to. It just depends. But I want at the end of the day for it to look cosmetically like it was never there. And so, yeah, we can get rid of all of those little imperfections.
So like, I'm curious, like, since this is elective, it's not really like an insurance thing, right? So like, what is somebody looking at out of pocket? Like, let's say for me, like, say I got this mole thing. It's been like bugging me my entire life. You know what I mean? Like, what is somebody looking to pay for,
So ballpark in that, it depends on what kind of tool I have to use or device, but typically for something like that, you're going to be running between 70 and $20.
Really?
Yeah, somewhere in that range. So insurance almost doesn't come into play even when that happens.
Yeah.
And if it's just the one, we at our place, some places charge per mole, per skin tag, per, cherry, meningioma, whatever. I just charge per time. So if it's going to take me 15 minutes, I charge for every 15 minutes. And so if you come to me, I can probably get 12 things off your face in 15 minutes, or your underarms, or your wherever you got skin tags, or any of it. And so I have all the tools. I'm going to go to work. I'm going to take care of all of it. And that doesn't change the price. It's just what it is for the 15 minutes. So
interesting. So what would you do, like, for something like this? What would you do? How long would it take? And does it hurt?
So for that, first thing I'm going to do is assess it. We're going to blanch it. I'm going to kind of press on it, see if it's vascular, if there's a lot of blood flow to it, or whether it's just pigmentation. It might just be basic benign mole. At that point, then I'm going to assess if it's vascular. I'm going to get real technical, but if it's something vascular, I'll grab a neodymium YAG laser 1064. I'm going to grab, or if it's just pigment, I'm going to grab a 755 or maybe an IPL photofacial device. Could even be plasma or high frequency. There's a lot of tools I have. It's just been what's going to be the best thing that at the end of the day will cosmetically look better, like it was never there in the first place. So out of any of those tools, I have to first assess it, say what's going to be the best path forward. And then from there, when you say, does it hurt? I guess one, it depends on your pain tolerance. Usually everything's just a little uncomfortable.
Okay.
If it's something I know that's going to take me longer than 2 or 3 seconds to work on, then we'll just do a lidocaine injection. We'll numb it up. We can even just do something topically. If you're more anxious, we do laughing gas Pronox as well. So that's going to help with the anxiety. You'll still feel the pain. You just do not care at all. It's great stuff. For these though, what I usually will walk people through is this is going to take me 3 seconds. So what you have, what you're talking about, would take me about 3 seconds to get rid of.
Really?
And so if you can just take a breath, hit it real quick, we don't have to do any of those other things, and it's gone. So yeah.
Like, do you cut it or use laser? Like,
Mostly with those, we would use laser. We would use some kind of a thermal burning method. If it's a skin tag, we'll usually cauterize at the same time with either high frequency or plasma. But no, never really incisions or cutting or pulling anything out or having to sew anything or stitch anything back up.
huh? And it doesn't leave like a scar, or like there's not like a
There's potential for it, but the way we work it, again, there's no suturing or actual physical cutting of anything. Typically, no, it won't. You have maybe a 1 or 2% chance of it leaving not a scar, but what's called hypopigmentation, which means that the opposite of a brown spot, you'll actually have less pigment in that area, so it'll look a little white. Typically, also that's temporary. So that can be as soon as you get some sun, as soon as you get some pigmentation back in the area, you probably couldn't even find where it was.
But it'd be flat. Like I wouldn't, because like every shaving your head, like I've nicked this quite a few times, and it sucks. I have to and it bleeds, and it's just not having to deal with that. That would be, man, that's crazy.
Well, this is the same reaction. What I just said, the exact same reaction that I get from most people.
Wow.
Is that once I tell them what we're able to do, one, they didn't even know it was in the universe that could be done, and then two, when I tell them it's a simple procedure, I guess you could call it a procedure. It's so quick, it's so easy. You might have a little scab there for a week until it falls off. Then they're mostly like, man, I should have had this done years ago. So
yeah, that's interesting, because like I go to a dermatologist every year, and like they look at it and they're just kind of like, oh yeah, that's just there, and I'm like, okay, well, they're like, it's not cancer, so just leave it. I'm like, okay, and it for me, it's not a cosmetic thing. It's more of like, it's just a pain in the butt to like shave my head, and it's like annoying. Interesting. I guess a half cosmetic, I guess, but I just grown to
again, as long as it's getting checked, and that's what we make sure of. I've had at least over a dozen clients in the last 6-7 years that'll come to me and they're like, oh, I got this sun damage, can you get rid of it? And they've been going other places and getting photofacials over the years, but that one just keeps coming back. And then they keep going and they keep getting these laser treatments. But I look at them and I say, you need to go get that checked. And they've never been told that before. It's just like, oh, the laser will get rid of it temporarily. I say, well, you need to go get that checked. I can't touch it. It looks very suspicious to me. I won't work on anything suspicious until you give me the go ahead from a dermatologist.
Okay.
And I've had at least a dozen clients in the last 6-7 years that have gone and they're like, yeah, it's cancer. Dang. And so, I mean, even my aunt was one of them, where about 5 years ago or so, she had one right on the tip of her nose and didn't know what it was. Cleared up her cheeks, everything else. And I was like, that one looks weird to me. And then she ended up being basal cell. And so she had to get radiation just isolated to her nose. But
wow.
It was something, she never would have caught it. So